Hello, everyone, and welcome to the Operation M.I.S.T podcast, where we bring amazing people on to talk with our listeners about things that can impact their bodies in terms of showing up to pregnancy as healthy as possible, getting through pregnancy without any unnecessary complications, and then thriving and surviving delivery and the period afterwards. And so I got introduced to this beautiful woman, LaTasha, a couple of weeks ago because we were doing a more than a period party. And for those of you who don't know, we essentially get together with ladies of all ages. The youngest has been 7, the oldest has been 78, and just talk with them about things that they need to know about their bodies. And when she reached out, she was specifically reaching out about an issue that really plagues our community. And I was just so grateful in reading her email that I knew we had to connect. And then after speaking with her, it was evident that she needed to be on the podcast so that her voice would not only be at a party, but that it could be spread across the nation and beyond. And so, LaTasha, can you please introduce yourself to our listeners and tell them what is it that you do and how did you get to where you are?
All right. Hello, ladies. My name is LaTasha. I am currently the Women's Health Coordinator for Preferred Fibroid and Vascular Center. My specialty is women's health. I have been in the spectrum of uterine fibroids for the last 6 years. So I have a passion now for women who suffer from uterine fibroids. As you so eloquently said, we primarily, as an African American community, suffer greatly from fibroids. So now I have a passion for fibroids and educating women of all ages what uterine fibroids are, how they affect us, and how we can treat them and hopefully not suffer from them as much as we currently are.
I love that. Okay, wait. So can you tell us, because you already jumped in and said, you want to educate about what it is. Can you tell us what are uterine fibroids?
So uterine fibroids are non-cancerous muscular tumors that live within the uterine wall. They are like hard rocks that grow on our uterus. They grow in the muscle, they can grow intracavity, and they can grow outside of the uterus. There's no rhyme or reason. There can be one fibroid, there can be 100 fibroids on the uterus, but they are mostly non-cancerous masses that grow on our uterus.
And so what is the problem? So for someone who's never experienced a fibroid or doesn't know anyone has a fibroid, what is the problem with a fibroid being around the uterus, inside of it? What is the problem with that? And what symptoms would someone experience maybe that has a fibroid and they don't know it?
Right. So I'm going to say probably 90% of women know someone with fibroids if they don't suffer from fibroids themselves. But if you don't know what fibroids are or what they cause to our body, they grow in our uterus and they grow about every 6 months and they kind of grow. Let's think of it as a baby growing in our uterus. Fibroids are kind of the same thing. They grow inside our uterus every 6 months. And as they get bigger, our uterus begins to expand just like we're pregnant. So sometimes you'll see women who have the big bully bulge and they're like, man, I work out 3 times a week at the gym. I'm at yoga. I'm doing 1,000 crunches and my stomach won't go away. Well, guess what? Your stomach won't go away because you have this hard rock growing inside your uterus that's making it protrude. So that's kind of the bad part about uterine fibroids. As far as symptoms goes, oh my gosh, don't even get me started. There are a million symptoms for uterine fibroids. The most common symptoms that women frequently report are painful cycles, long cycles, anything lasting over 7 to 10 days. Anemia, if you have a low hemoglobin, sometimes, those are reported, painful sex. But outside of those symptoms, there are such things as hair loss, constipation, urine frequency, brain fog, chewing of ice, chewing of dirt. The list goes on and on for the symptoms of fibroids. And that's why I think women suffer so long with fibroids without being treated, because you really don't realize that the symptoms that you're having are equated to uterine fibroids.
Wow. So for people who come and visit you all, Do you ever see any of them? Because I know I have a good friend, and just so that people are listening, they understand. You may know someone with fibroids, but might not really understand the extent of what they go through mentally, physically, emotionally as a result. Have a friend whose sister suffered with fibroids so badly that she was bleeding through pads at work,
Mhm.
constantly up and down to the bathroom, and could
Mhm.
not keep a job.
Yeah.
And so, and then, of course, you're presented with the option a lot of the times that, well, the best way to get rid of it, especially if you're not trying to have children, is possibly to have a hysterectomy or have it surgically removed. You have people who that they're told that that's their only option. And when you're presented with that option as the only option, you just turn away from it and you don't look to do anything else, because that's not the option you want to take. And so it's really nice to see that your center provides other options. So can you talk about those options, and then also why you don't just jump to a hysterectomy when someone says something is wrong, or even a myomectomy, where you remove the fibroid in the traditional sense?
Yeah.
So yeah, please go ahead.
Yeah, absolutely. So to your point, you are exactly correct. Most times when we go to see our GYNs, the first thing they throw at us is hysterectomy. And unfortunately, studies show that probably 65% of women that get hysterectomies in a year are African American that are getting them for fibroids versus white women are having them at about 28% for the same diagnosis. Right. Did you just see your face? I just saw your face. Like, look at the gap. 65% of African American women are getting their uterus removed every year for uterine fibroids, where it's 28% for Caucasian women, and we're doing 500,000 hysterectomies a year in the United States. So
Wow.
the majority of those are being done by doctors that are performing them on women of color. Now, with that being said, hysterectomy is not a bad option. Obviously, I'm not a clinician, I'm not a medical provider, so this is definitely not medical advice, but hysterectomy is not a bad option if you have uterine cancer. I will say, like you said, a lot of times they'll say, oh, you're not having any more kids, just get rid of your uterus. Yeah, that all sounds great. But what happens to my body after I get rid of my uterus? Let's talk about the 6 to 8 week recovery for hysterectomy. Let's talk about the hospital stay. Let's talk about the estrogen hormone replacement that I'm going to receive post hysterectomy. Let's talk about the mental issues, the depression, the low libido, the dryness, all those things that come along with hysterectomy. But again, here at Preferred Fibroid, we believe that women should know all of their treatment options, whether that's hysterectomy, myomectomy, or UFE. Now, in the case of myomectomy, which is also a surgical approach, they are going to definitely go in. They are going to take out the largest fibroids. You will be able to conceive naturally after a myomectomy, but you will have to have a C-section to deliver, but you can't conceive after myomectomy without a problem. The issue that we have with myomectomy is that a lot of times they're just taking the big fibroids and they're leaving the little fibroids behind. So what happens is 2 to 5 years post myomectomy, you've seen those little fibroids begin to grow again. And now you're right back at square one with all your symptoms again, because all of the fibroids were not removed during the first procedure. So we
Wow.
often see women who've had 2, 3 myomectomies before they end up here at Preferred Fibroid to get a UFE done.
Now, can you tell me, why are women told that they can only have C-sections following a myomectomy?
Because there's scar tissue and they've cut kind of like they've already cut a C-section line for the myomectomy. So with the scar tissue that comes along with myomectomy, it's just safer for you to have the baby delivered cesarean. But you definitely can go on to have a successful pregnancy after myomectomy as well as UFE. Hysterectomy, obviously, you're not having any children after hysterectomy. So that's one of the ones that I say you always weigh all of your options before you just jump into hysterectomy. But by no means am I telling any woman that if that's the best treatment option for you, then absolutely go with it. Just know, just ask all your questions. Just be diligent about making sure that you ask what the side effects are. What am I going to experience after this? What is my pain level going to be? You know, unfortunately, sexual being is very important in our community. So make sure you ask the questions: how am I going to feel from a sexual standpoint? Am I still going to be able to make my spouse happy after this? Because those are things that we ultimately see, women who are post hysterectomy end in divorce, because now they can't do the things that they used to do, or want to do, to be able to keep their household at peace. Um,
Yeah.
for us, UFE is it. Uterine fibroid embolization, which is a non-invasive procedure that cuts off the blood supply to uterine fibroids. And once the blood supply is cut off, the fibroids begin to shrink and they die. So that is obviously the approach that we push women towards. But again, our goal is always to educate women about all their treatment options, and then allow you to be able to make the informed decision about your own care, rather than feeling like you are being pressured into something, rather than you being able to say, okay, I know what 1, 2, and 3 entails. Let me see which box I want to open.
Absolutely. And so, what is the success rate of UFE after you do the embolization? What do you see 5 years down the line?
So it kind of depends on age when you are treated. So typically in the UFE world, we treat women somewhere average age 35 to 60. And so when you're treating women that are in their late 20s, it is possible that the fibroids can grow back, because you still have a long time before you naturally go into menopause. So when it comes to the younger ladies, we definitely want to make sure a couple of things. We want to make sure before we treat someone in their 20s that they have had a chance to conceive children naturally, because we don't want to cause any type of trauma on the uterus that has not had a chance to conceive. So we definitely want to make sure you've conceived. We want to make sure that you are aware that if you do have a UFE early on, that it is definitely possible that the fibroids can grow back. When we're talking about women who are 35 or older, typically once you have the uterine fibroid embolization, the fibroids are not going to grow back. There's not enough time for them to grow back before you naturally go into menopause. And naturally, when we go into menopause, the fibroids begin to die on their own, because there's no longer any blood and estrogen feeding them to keep them alive. So it just kind of depends on the age range of when you're being treated. But definitely in the UFE world, we shy away from treating women that have not had children yet, or who are on the younger end of the early 30s or late 20s.
Okay. And so let's say that someone is early 20s, 30s, early 30s, and they just want some help with symptom management. What are some natural ways? So you don't do the UFE, you don't do any of the other interventions. How can they, from a diet standpoint or movement, however you tell them, what are some lifestyle interventions that they can do to kind of ward off the symptoms?
Yep. So mostly the lifestyle changes are definitely preventative. Once you are in the cycle of the pain of the fibroids and they're really aggravated and they're causing you a lot of issues, a lot of the things that you could do, um, preventative, have kind of passed, because now you're right in the meat of the pain. But if we're talking about knowing that you have fibroids and trying to be on a preventative side, then definitely we want to maintain a healthy weight, because fibroids are attributed to our body weight and how much mass we have on our body. So we definitely want to make sure that exercise and diet is definitely very, very important on your fibroid journey. Things like fish, lean meats, fruits, and veggies are very important to incorporate into your diet. Not so much red meat and alcohol. Those are some of the things that we know can aggravate uterine fibroids. So less red meat, definitely not more than a glass of wine a day, is too much for a woman that is dealing with fibroids. Those things aggravate the fibroids. Exercise is very important, keeping your body moving, keeping cardio going. Yoga, we've seen a lot of women report that yoga and Tai Chi helps with the symptoms of fibroids. And then one of the biggest things that we see that helps is vitamin D deficiency. So naturally, people of color have a vitamin D deficiency because of the melanin in our skin. So because of that, we have a vitamin D deficiency. So we see that in studies that when we have vitamin D deficiency, women with fibroids have larger fibroids. So definitely incorporating vitamin D into your daily regimen, whether that's trying to get out and get some sun naturally, which is a hard way to get vitamin D, but it works, or vitamin D supplements, because probably 90% of African American people are vitamin D deficient. So those are probably the biggest ways. Herbal teas, green teas definitely help. There are some herbal medicines out there in the world that women have reported that they get help from. But from a medical standpoint, I think the biggest thing we would tell our patients is to maintain a healthy weight, exercise, make sure you're getting a nice diet of fruits and veggies and lean meats, and definitely make sure you get good vitamin D supplements into your body.
Yeah, and I love what you said about the vitamin D. It is hard to get, but we have got to start prioritizing ourselves. It is so
Absolutely.
important for every aspect of our bodies to just get out,
Yep.
get outside, breathe,
Get
get
out and
access.
move. There was a
Yeah,
time in society when you and I were growing up, our parents made us go outside and move and play. You didn't get to come inside until the street lights came on. So we were
exactly.
out there and we were playing all day long and we were absorbing all that sun. Unfortunately, the generation that we are in today, our kids don't get out as much. We, for that matter, don't get out as much and sit in the sun. While sun is a hard way to get vitamin D, it definitely gives us vitamin D. But if you don't get out in the sun, guess what? You can stop at your local Walmart or Publix and pick up some vitamin D supplements. But definitely, vitamin D is a big, big one that we see to helping in keeping the symptoms of uterine fibroids at bay.
Yeah, and then just rechecking levels. I know some people, they do take the supplements and then they notice that it doesn't help. And so
Yep,
just figuring out what is happening from a process standpoint to
yep.
where the body's not absorbing it and using it the right
Yeah, or
ways.
even and even when the supplements don't work, then take it one step further and go see your primary care doctor and ask for a prescription. I am an advocate that you have to advocate for your own body. If you
Yeah,
and me and other women do not go into every doctor's office with a game plan and advocating for ourselves, they're going to tell us exactly what they want us to hear, and that is it. They are not going to go any further unless you and I go further. So I always say, get 10 opinions. I don't care if you got to go to 20 doctors and get 20 different opinions before you decide what treatment plan is best for you. Get all your opinions. Make sure that you, as a patient, is comfortable with whatever diagnosis we're dealing with, whether it's uterine fibroids or whatever other diagnosis we have. Make sure you are comfortable with what you are choosing to do with your body.
absolutely. Absolutely. And I love that you all get on the front end of the fibroid issue because, when we show up to pregnancy with fibroids, it can cause a lot of unnecessary complications, sometimes miscarriages,
Absolutely.
bleeding,
Absolutely.
just premature
Yep.
labor.
Yep.
There are a lot of things that can happen. And I don't know, just love that you all are available and are very conservative in your approach so that women are not having to choose between fertility and living a quality lifestyle.
Absolutely. And when it comes to uterine fibroids and pregnancy, as you said, it's such a hard thing to fight with when you're pregnant. A lot of times women don't even find out that they have fibroids until they're pregnant. So you
Right.
walk into this office and you're so excited, yay, I'm pregnant, right? And then you get an ultrasound and they're like, hey, there's a fibroid growing alongside your baby. And now you're scared because you're like, what is a fibroid and why is it growing alongside my baby? And a lot of times, so often, it's so terrible, but so often these pregnancies are ending in miscarriage because the fibroids are stronger than the fetus. And so they're
Mhm.
eating the fetus out for all the nutrients. And these women are suffering miscarriage after miscarriage after miscarriage because they're not able to hold the baby for fibroids. So then they start looking for alternatives of, okay, what can I do? I'm tired of having miscarriages because of fibroids. What can I do to try to successfully hold on to my baby? So now we're at the, okay, well, uterine fibroid embolization allows you to keep your uterus intact and allows you to successfully carry your baby. And after we kill the fibroids and they shrink, they're no longer these hard rocks that are feeding off of your blood supply, stealing from your baby. So now you can naturally conceive this baby and hold on to this baby for 9 months and naturally deliver a very healthy baby boy or girl. And at the end of the day, that's the goal. That's why we perform uterine fibroid embolizations, to give women the relief, obviously, that they want from the heavy bleeding, the pain. As you mentioned earlier, you have a girlfriend who can't keep a job. So many women can't keep jobs because of the fibroids. So it allows you to be able to conceive and still live a successful, happy life. We're definitely all about improving life of women through uterine fibroid embolization. And that's our goal. My goal, I don't, honestly, if I'm being totally transparent, whatever you decide to do, as long as you are treating your uterus and making sure that it's healthy, do what you want to do. I am an advocate for UFE, obviously, but I am a firm believer that I want you to have all your options, know all your options, and then make your decision based upon that.
Absolutely. And so can you tell us, so we know about your job and what you do to advocate for women and really empower them. And I just love hearing all of that part of your story. What is the driver? How are you a mom? Are you, tell us a little bit about your story.
I am. So I am a mom of three. I have they're all adults now. So my oldest is 24. I have a 21-year-old and I have a 19-year-old who is currently off in college. I have been married for 8 years. My husband and I have been together for about 27 years at this point. And we have two grandchildren. So we have a 1-year-old granddaughter and a 2-year-old grandson. As far as pregnancy, wow. I was a young mom. I had my first one at 18. That was a life-changing experience for an 18-year-old who really didn't know how to navigate life at the time. So it was very challenging, I would say, to be an 18-year-old teen mom that didn't know how to care for a child, probably didn't really know how to care for myself at the time. It's so funny. Side note, funny story. After I had my daughter, I used to always get on the city bus and I would go to a friend's house and I would literally only take one bottle and two diapers because I refused to carry a diaper bag, right? So I would get over there every time and my friend would say, Tasha, what is wrong with you? You know you're going to stay tonight. Where is the bottle and the diaper bags? But that was the youngin' in me. That was the not knowing how to properly care for another human being. 2 years old. But we grew together. She and I, we grew together. We learned together. She is the star of my eye. She's awesome. I didn't have many postpartum issues with her. I think because I was just so young and just so all over the place, and I was still kind of in the world of being out there partying and chilling and all the things you do when you're a teenager. So I don't know if I had postpartum because you just move so fast that you don't realize what's going on in life. The second kid, same thing. It was easy breezy. It was just like bringing on another kid, but just knowing more. Now, with my third one, that's when I realized there was really a such thing as postpartum depression. I really didn't care about it. I really didn't think about it. It wasn't something that affected me. I was young when I had my children. But with that third one, it was something after I delivered my son. It's just everything about me changed. I went into a deep depression. It was a lot of dark days. It was a lot of yelling and screaming at my children, and not understanding why I was so angry when I was a new mother and when this was my first son. But yet I was still so angry and I was constantly yelling at the kids. I was constantly spanking the kids. And someone came along of the way who I didn't even know. I didn't even know this person. And he just said to me one day, he said, God told me to tell you it's not your kid's fault. It's not
Wow.
your kid's fault. And I looked at him and I said, you don't even know me. You're just here to move some furniture from one house to another. And he said, you're right. I am here just to move your furniture. But God told me to tell you that it's not your kid's fault, that this is the life that was destined for you to walk. And you need to stop spanking and yelling at your children so much. And ironically, that day, 18 years ago, I stopped with the spanking. I stopped with the yelling and screaming. And I had to evaluate me. because it wasn't them. They were just children. They were babies. They knew nothing. I had to evaluate me and what was going on within me. And that's when I started realizing, okay, Tasha, there is a thing called postpartum. There is a thing called stress after delivery. There is a thing called depression after delivery. There is a thing called being overwhelmed after delivery. All those things are natural. And unfortunately, sometimes in our community, our grandparents and parents didn't tell us that it was natural to go through some of those things and that it's a part of life and that we can make it through it. A lot of times we're told to suck it up,
Mhm.
buttercup. Keep moving. You got this baby. You got to take care of this baby. Keep moving. You got to work. You got to do this. But we forget as mothers that we also have to take care of our mental health. And without our mental health, we can't be successful parents to our children. So that was a learning process for me after I delivered my son and learning how to bring it back and realize that these kids were blessings and that they did not ask to be here and that they did not deserve the mother that they had in that season. So a lot of growing pains. So I think a lot of our women now that are going through having children also have a lot of those same things going on. And sometimes you're embarrassed to talk about it because you think that you're the only one going through it. You're not. You are absolutely not the only one going through it. So many women go through it. There are chat groups, there are people you can talk to that can help you get through it. And especially when you're a young teen mother, having children, it's really, really hard to go to someone and say, I'm feeling down, I'm feeling depressed, I'm feeling like this baby doesn't love me. Why does this baby always cry? It don't want me touching it. Because then you get the stigma of, well, I told your young tail not to go out and have no kids. So we get afraid to reach out and ask for help. And I think in our Black community, we need to realize that there's nothing wrong with mental health. There's nothing wrong with reaching out and asking someone to help you get through your trials and tribulations because we all have them. And irregardless of if we all want to admit that we have them, we all have trials and tribulations. We all have had dark spaces in our life where we just didn't know what we were doing, where we were going, and what was going to happen next. So I just think that all young ladies, whether you're a teen mom or whether you're a mom that's starting to have your journey in the 30s or 40s as they're now having kids late, remember that you're not alone. There are other mothers out there that are suffering just like you. There are people that you can talk to that will help you get through that tough journey.
Oh my goodness. Oh my goodness. So much from what you just said. First of all, thank you for sharing your life, your story. I think that enough of us don't do that. Secondly, I think back to how the guy spoke with you and talked to you, what God laid on his heart to tell you. I think that I feel like as a society, we've gotten away from doing that. We may think something and not say it to someone because we don't know how they're going to receive it,
Mhm.
if we feel like they're not going to listen. And I just think that that is a big reason that things are going wrong in the maternal health space right now. And if we would just say, that is not a good idea,
Mhm.
this may be a better option, and give people the option of making informed decisions and just giving them information, giving them the benefit of the doubt, not judging them, there we would be so much farther along as a nation.
Absolutely.
And
Absolutely.
you laying this out, just saying what you went through and how you've changed. I mean, it only takes a second
Only a
for
second.
someone to say it. And then imagine if he hadn't, where would you be as a parent today?
Yeah, exactly. Imagine it when I look back all those years, and that was probably, I don't know, 16, 17 years ago. When I look back all those years, I say, where would I be? Where would
Yeah.
my kids be? Would they still be successful adults? Would I have been able to send all three of them out into society knowing that they are going to be successful members of society? Had someone not just stopped and said, Tasha, you're doing too much. Just stop
Right.
it. Just stop it. And so people don't receive these days as they did before. You know, when we were growing up, we had a village. You used to hear, you're raised by a village. You know, you got in trouble at school and your mom and dad might be at work till 10 o'clock at night. But don't worry, Aunt Sally on that gonna be on that porch when you get home from school And she gonna make sure you get your tail in that house and don't come back outside until your parents get home. Because see, we had a village. We had someone that cared enough to say, this is not right. This is not how you do it. No, you may not take my advice, but let me at least give you the advice, because it could only help. It could only help. And closed mouths don't get fed. Let's be honest. When you don't open your mouth, you can't get the help you need, because nobody knows you need help. So
Right.
walking around life every day with this, oh, woe me, oh, things have happened, oh, my life, my life, my life, until you open up and you explain to somebody what you have experienced in life and what things can help you get past those trials and tribulations, you'll be stuck in that oh, woe me cycle for the rest of your life. So it's
Right.
easier just to open up to somebody. It doesn't have to be a psychiatrist. It doesn't have to be a psychologist. It could be a school counselor. It could be a church pastor. It could be Operation M.I.S.T. It could be anybody who is just willing to have a listening ear for 5 seconds just to hear you vent your story. And you never know who may have the information you need to change that around.
Yeah. And I don't know if you know this, but I have a really big heart for teen moms.
Mhm.
And I think that it is because there is a stigma, or there's a huge stigma on having children before you're married, before you graduate from
Mhm.
high school, before you get
Mhm.
into your career. And the problem with that, now that I talk to 40-year-olds, they're like, I wish I had never taken that on from society,
Mhm.
because I had an abortion and now I can't have kids.
Yeah,
And whether it's
absolutely.
related or not, they think it's related, and they carry
Mhm.
that guilt
For
and
the
it
rest
and
of their
have
lives.
that for the rest of their lives.
It's
And
so many
sometimes,
women.
go
Sorry
ahead,
to
please.
interrupt you, but there's so many women that I have met who said just what you just said. I blame myself for not being able to have a successful pregnancy because of an abortion that I had when I was a teenager, because of the stigma and because of what people said about me as a teenager, and they can't conceive. Another side note, so I had my tubes tied after my third son. And I had them tied because I just didn't want any more children. I was 24 when I had my third son, and the surgeon was like, look, Miss Jones, I'm not going to cut your tubes totally off because you're too young. And what if one day you want to have another child? Well, I knew I didn't want no more kids. And at 43 years old, I didn't have any more kids. But the regret that I live with is not being able to have any more children, because I wholeheartedly believe that it's a blessing to have a healthy uterus that can conceive children. And every woman is not blessed by God to have that uterus. So, who am I to take away the blessing that was bestowed upon me to have children when there's so many women out here that are begging, would give their life and limbs to have just one child? So I'm with you. I have a heart for teen moms because I was one, and I listened to all the negativity of, you're not going to be anything, you're not going to make it because you're a teen mom, and this, that, and the third. Well, let me be a testimony to all your girls watching. I was a teen mom. I
Yes.
sit in front of you right now with only a GED. I do not have a college degree, but I have a six-figure income as I sit in front of you right now. But God. So
Yeah.
don't listen to the naysayers that tell you because you're 17 and you're in your senior year of high school and you may have to skip a year of college that you're not going to make it. Yes, you are. Yes, you are. Yes, you are. Never naysayers. Always, never negativity. Always positivity. You are going to make it. You're going to, if I can make it, I am a foster child. I was a ward of the state till I was 18. If I'm being totally transparent with you, I prostituted myself out until I was 16 years old. My mother was a crackhead who sold me to men for drugs. But God, I'm sitting here today at 43 telling you that you can do it. I have a six-figure income. You can do it. And all I have is a GED. So stop listening to these people that tell you to have an abortion at 16 because you're too young. God don't make no mistakes, baby. He don't make no mistakes. And while it may be a hard path at 16 to be a mother, he don't make no mistakes. So if he blessed your womb at 16, he meant for you to have a baby at 16. There's a lesson in that. There's a lesson in it. Take it, embrace it, love it, care for your child, but stop letting people in society dictate what you do with your uterus.
Amen. Amen. The only thing I can say after that is that if you are looking for a community, you don't have to be a part of Operation M.I.S.T. You can reach out and we will support you and love on you and care for you, because I think that the only thing that combats the negativity in society that exists sometimes in society is love. Love never fails. And I think that as a
Never.
teenager, you have to know that there are people who love you, support you, have a similar story, and don't want you to feel the way that they were made to feel. And
Yep.
so
And
thank you.
love wins every time. And remember, there's always somebody out there. I had to learn through all my trials and tribulations, through all the things that I have endured in my 43 years, there's always one more person out there that had it worse than me.
Mm.
My test is a testimony. There's a young girl out there that's going to listen to this podcast and she's going to relate to me. And she's going to say, dang, that story sounds familiar. But guess what? I did it. So I'm an advocate, just like you. I'm an advocate for uterine fibroids. I'm an advocate for women, but I have a huge passion for women and girls who are struggling with knowing that it's okay to not be perfect. It's okay to not fit the mold of what society says a young Black girl or a young, whatever color, a young woman should represent. It's okay to not fit the mold. It's okay to be you. It's okay to be you. We are not all made the same. We are all made in his perfect presence, but we are not all the same. We all have different DNA for a reason. We will all walk different paths. We will all have different tests. We will all have different trials. But at the end of that, there is a testimony. I don't believe that God ever gives us a struggle that is not going to end in a testimony. It's up to us. It's up to us to figure out how we want to fight for what we believe in, how we want people to see us, how we want to leave this world, and what we want people to say about us. When I leave this world, I want people to be like, that girl was transparent. That girl always told the truth. She ain't shy away from her childhood. She ain't tell y'all it was all peaches and creams trying to get to where she got. She told y'all that she had to fight tooth and nail to get to where she sits today, and it's possible. So I'm about believing. I'm about going into them group homes and telling them girls, I'm just like you. I'm just like you. It took one person to say to me, Tasha, you're not the only one that has gone through those struggles. So have I. And when you realize that there's somebody out there that has a similar story to you, it's so much easier to navigate that story because now you don't feel so alone. So I want girls to know you're not alone. You're not alone in this, sweetie. Women, you're not alone in this. The women who are 30 and 40 years old and still dealing with childhood trauma because we've been told that what happens in the Black home stays in the Black home. We're still dealing with trauma at 30 and 40 years old. You're not alone. We are all still dealing with some form of trauma at 30, 40, 50, 60 years old. But guess what? You can get through it. You can get through it. It's just a matter of being able to open your mouth and asking for help. Even if it's through a chat group, online chat group, it doesn't have to, it could be anonymous. It could be, you don't have to necessarily tell people who you are if you're worried about your standards or if you're worried about who you now have become and you don't want people to know, well, I work for a Fortune 500 company and I make all this money a year and I don't want people to know, even though I got 6 master's degrees, I don't want people to know that I had a terrible childhood. Well, do it anonymously. Get into one of these anonymous chat groups where you can vent your frustration and you can get people to help to give you information on what helped them. If you don't necessarily want people to know that you had childhood trauma or that you may have gotten a miscarriage at 17 and now at 40, you're still beating yourself up that you can't conceive. It's not your fault, mama. It's not your fault. It's not your fault. That abortion, while it may have caused some scar tissue in your uterus, is not your fault. Forgive yourself. Forgive yourself. It's okay. We all make mistakes. We all have done things in our life that we are not proud of. It's okay. Forgive yourself. Forgive yourself. Because if you don't forgive yourself, You carry that guilt for the rest of your life, and you cannot be a successful member of society carrying guilt around with you for the rest of your life. It's like all these different bags on your back and you're weighed down. Stand tall. Stand
Yes.
tall. Wear that smile. Wear that smile and say, yes, I made a mistake, but I'm still here.
Yes.
And no, I may not have the child that I so dearly needed and wanted. But guess what? There's adoption, there's fostering, there's aunties and uncles, there's big sister, big brother programs. There's so many other ways that we as women can reach out to our young children of color to help them to become successful members of society. So don't stop just because you were not blessed with your own child. Don't stop. There's so many children, so many children right now that are begging for someone to say, I love you. And that might just be you. That might just be you.
Yes. Oh my goodness. Oh my goodness. This talk was everything that I never knew I always wanted.
Oh, thank
Thank you.
you.
No,
Thank
thank
you.
you. You didn't have to share that. You came on to talk about fibroids,
Oh yeah,
right?
but as I said, I'm totally transparent and when the spirit moves me to talk about something other than fibroids, and that's what it is. I am here to
Mhm.
talk about fibroids, and I will plug my company, and I will give you the phone number, and I will give you the website. But guess what? If this podcast is going to help one young lady say, I can make it, then it was all worth it. It was
Yeah.
all worth it for me. It just takes one life to change. Just one life to change. And if we all can commit to changing one life, the world will be such a better place.
Amen. Amen. Okay, so tell us about um the clinic. I'm so sorry. I'm
All right.
so just still in our last conversation.
All right.
So
So
plug all the
preferred
things.
Preferred Fibroid and Vascular Center is a clinic where we primarily treat patients with dialysis who are struggling with dialysis, but we also have a branch of women's health where we focus primarily on women's services. So we are focusing on uterine fibroids. We treat a diagnosis called adenomyosis, and we also treat pelvic congestion syndrome. We offer the uterine fibroid embolization, which is a non-invasive procedure that allows you to keep your uterus intact while the fibroids are being embolized, or for layman's terms, we kill the fibroids so that they begin to shrink and die, which allows them to not press down on different organs and cause issues like urine incontinency, constipation, the frequent bleeding, the 30 days of cycles. So our goal is to alleviate some of those symptoms that you're feeling through the embolization. We currently have two locations in the Atlanta area. We have a location in the Camp Creek area, which is near the Hartsfield-Jackson Airport. And we also have a location in the Dunwoody area, which is the perimeter side of town. We have two physicians. We have Dr. Shrenik Shaw, who is an interventional radiologist. He works out of my Camp Creek office. And we also have a female physician. Her name is Dr. Denise Smith, and she's a vascular surgeon, and she does my procedures out of my Dunwoody office. The good thing about our practice is we have two locations that you can go to. We have a female doctor that does this procedure, which there are, I believe, there's maybe one other female doctor in the state of Georgia that does this procedure, but that sets us apart. So we do have a female doctor that does the procedure here, which sometimes make women more comfortable. And then the other thing that sets us apart is when you have to come in for your procedure, we offer transportation. So you do have to have your own way to your consultation, but the day of the procedure, for some reason, if you do not have anyone to bring you in the car, then we'll provide transportation for you and your caregiver to our center and back to their home. And so that's kind of how we work. As far as the embolization goes, the procedure itself takes about 30 to 45 minutes. The doctors go in through your right bikini groin area, and they put a little catheter up to your uterus, and they put embolics or blocking agents at the tip of every artery that is feeding a fibroid, and that allows us to kill all the fibroids in your uterus, whether there are 3 or 100. We're able to embolize and kill all of them. Recovery in the office is about 4 hours, and then you go home the same day. As far as post procedure, the first 2 days after the embolization are really tough. There's a lot of pain associated with that, but that's mostly because the fibroids are dying, and we really have to think of them as a living being. And when you kill anything that's living, it naturally fights back. So the fibroids kind of fight back for the first 2 days. So you feel some cramping and contracting in your belly. That is the fibroids dying. That is a good sign that the procedure worked. After the first 2 days, the pain kind of just gradually goes away. Around the 5-day mark after the procedure, you are back up on your feet and getting back to normal. As far as recovery goes, though, we allow up to 2 weeks off of work for this procedure.
Wow. Now, are the ladies put to sleep in the clinic?
So they are not knocked out. There is a conscious sedation given, which means you're kind of in a twilight sleep. So if we tap your shoulder and say, hey, wake up, you're going to wake up. You're probably not going to remember much of the procedure, but you are not knocked out during the procedure. You are sleeping during the procedure. You do not feel it. You do not remember it. You don't really hear anything around you. But you definitely are going to sleep through it.
Yeah. Can you tell us, as we kind of close out, do you have a story that you particularly remember from someone who's had a procedure done at the clinic? And if you can't think of it right now off the top of your head, then that's fine. But just how the procedure changed their lives.
Yeah, absolutely. So I've worked in a few different clinics, but since I'm kind of gauging on preferred fibroid, we have a patient who is our spokesperson. So she actually is on all of the literature for our office. Her name is Keisha Bivens, and she had the procedure done with us. And she was in her 40s when she had the procedure done. And she says specifically she wishes she had known about this procedure earlier because it totally changed her life. It changed the way she was able to dress. It changed the fact that she didn't have to wear panties, diaper panties anymore. It changed the fact that she didn't have to have a change of clothes with her at her business meetings. She's a very high level executive. And so she's in a lot of very important meetings. So it changed her not being able to have the fear of standing up and having a gush of blood fall out of you in a boardroom full of full of men, right? Full of men. So here you are, this woman, and you stand up and you have this gush of blood, which is mortifying. So it's so refreshing to hear the patient say, I feel so much better. My belly has gone down. I don't have the long cycles anymore. I don't have the pain anymore. We have a patient who had 3 miscarriages before UFE, and she was like 43, I think, when she had the UFE, and she had decided, I'm never going to have kids. I'm just never going to have kids. That's just what it is. It's not meant for me. Well, 3 months after she had the UFE, she was pregnant. We have a baby girl now who is 3 years old. So those are the type of success stories that push me to advocate for women and for our uteruses, because if you want to have a child, don't let fibroids keep you from having a child. There are treatment options. There is a myomectomy. There is a UFE. Do something, but do not give up on your journey of wanting to be a mother because you can't figure out what to do with your fibroids. Like I said earlier in our podcast, get 10 different opinions. Go to 10 different specialists. Get all the opinions you need, but make sure your uterus is happy and healthy, because a happy and healthy uterus produces a happy and healthy baby. And that's the goal at the end of all this.
Oh my goodness. Oh my goodness. Thank you. Thank you. Thank you. Thank you for your time, for your transparency, for your love, passion, for everything that you're doing in the community to empower us. We need it. We need to hear stories like this and just know that there is help.
There is help.
There is
Absolutely.
help.
Absolutely.
Yes.
If any of you ladies need our help, want our help, have questions about what we do, please don't hesitate to reach out to me. My direct office number is 470 805-3409. That comes directly to my cell phone. So it is literally an open line 24/7. Whenever you feel the need or whenever you have questions, please call me 470-805-3409. Our website is www.preferredfibroid.com, and our social media handles are Preferred Fibroid on Instagram and Facebook.
Awesome. Thank you. Thank you
Thank
again so
you.
much. And we will definitely
This is
stay in
so
touch.
awesome. Definitely stay in touch. I would love to come out and talk to your ladies anytime you want me to come out and speak to your girls. I'm happy to, I'm on board with you.
Thank you.
You're welcome. Thank you for having us. I really appreciate you guys.
Yes, ma'am.